Tonight, New Hampshire continues its push to get as many Granite Staters vaccinated as possible. A months-long mission now progressing through Phase 1B. But as more people receive their shots, questions follow about what the vaccine means for people on an individual level.
I think it's very, very exciting that there's so much interest.
Dr. Holly Mintz is the Chief Medical Officer of Ambulatory Services for Elliott Health System. She says right now it does not appear certain groups of people benefit more from the vaccine than others.
And what the studies have shown is that the response is similar despite of your age, sex, race, etc.
Dr. Mintz says a full vaccination does not mean you're free to go about your business without following COVID-19 guidelines. Doing so can still contribute to the spread of the virus.
Even though you won't get sick, you could pass it along to somebody else who may not be vaccinated who could get sick.
A statement echoed by Dr. Beth Daly, Chief of New Hampshire's Bureau of Infectious Disease Control.
Which is why right now our guidance is still that we do need to be taking these COVID precautions, wearing masks and social distancing as we learn more about the vaccine and how it's performing in terms of actually reducing that transmission in the community.
And when it comes to travel, the state recently changed its quarantine guidelines. Anyone who travels 2 weeks after their second shot does not have to quarantine upon return. But health officials say it's still not recommended.
Even on these calls and other calls, we have repeatedly stressed that even if somebody is fully vaccinated, that is not a free pass to travel.
Tim Callery, WMUR News 9.